Money doesn't grow on trees, and there is no pot of gold at the end of the rainbow, but there is a pot. We call it our Culinary Fund. Culinary members don't have health insurance, not in the normal way. We don't have a big insurance company on Wall Street. Instead, we own our own Culinary Fund. Our fund is a pot of money. For every hour that each member works, the company puts in $4.31. $4.31 for every hour worked by every Culinary Union member. All in the pot. Your money. You worked for it, fought for it, negotiated it. But it's all our fund has. That money is all that's in the pot. What our fund does is write checks. $2 million a day. That's right. When you add up all the checks that our fund writes to pay all the medical bills for all the members and your families, it's $2 million a day. Your money paying your medical bills. You get sick, there's a check. The money comes out of the pot. You go to the hospital, a check. Your son gets in a car wreck, bigger check. You need heart surgery, much bigger check. If the checks are bigger than what's in the pot, the checks bounce, and our fund is out of business. This year, the pot was emptying. We had to take money that could have gone into your paycheck and put it into our fund so the medical bills would be paid. And we had to change some other things starting in the next few months. We call those changes better choices. By cutting out some labs, radiology places, cancer treatment and perinatal places, we protect quality, reduce some co-pays, get better access hours for service, and the latest cancer treatments. But we also have to raise some co-pays. The big one will come on emergency rooms. $350 if you use an ER when you should have used an urgent care center. Look, here's the hard truth. Money that belongs in your pocket is going into someone else's pocket. We can't afford it. Sadly, there are Culinary members who are abusing our fund, taking money from the pot, members putting fake relatives on our fund, going to the emergency room for the flu and wasting millions. We are going to do a complete enrollment program. Every member, all your dependents. You'll need all your paperwork, marriage licenses, birth certificates. We have to make sure the only people taking money from our fund, from our pot, are our people. Look, it's simple. Our fund is great, but folks forget where it all comes from. Blood, sweat, tears, all shed to build this. Did you strike for the fund? Strike to start it, have it, grow it? Many of us have. Did we forget? The pot is leaking badly. We have to plug the holes. All this means more and more of the money we negotiate in our contracts is going into someone else's pocket. Less and less will go into our paychecks. And unless we make a big change, we'll never get more than small change. In the long run, we have to build our own health system. The Culinary health system. Build our own health centers. Hire our own doctors and nurses. That'll take time. We will build one health center, then more. We'll start construction soon. We own this pot. We have to act like it. Take control of it. Protect it. Respect it. And yes, change it so that it lasts a lifetime.